Welcome to You and Your Health. I'm your host, David Bertone. Today's show is on location at my physical therapy practice here in Lincroft. We're doing a follow-up for our show that we did last month with Dr. Michael Cunningham. With Dr. Cunningham, we talked about joint replacement surgery for the hip and the knee joint. It was a very informative show where we talked about some of the procedures used in performing the surgery with both the hip and knee. We're going to follow that up now with the rehabilitation process for hip and knee patients following their surgery. I've brought some of my patients in today to demonstrate some of the procedures and techniques used during the rehabilitation process. So when we come back, we're going to introduce some of the patients and some of the procedures that we use to make them return to their prior level of function. I'm here with my patient, Renee Gast. Renee had a total knee replacement procedure done approximately 10 weeks ago. And we're going to go through some of the rehabilitation techniques to help her regain her motion. Primarily in the beginning, we work on reducing swelling because following the surgery there tends to be a lot of swelling in the joint. But over time, that swelling diminishes and you can start working on things that the person needs to improve their mobility. One of the most important things in knee replacement surgery is regaining maximum mobility as early as possible. And some patients, which we're going to demonstrate later on with another patient, have the difficulty of putting the knee really straight. And Renee was really good at doing that early on. And we worked on getting full extension of the knee, so that helps in the ability to walk. And when you don't have that extension, people tend to walk with a little bit of a bent knee ambulation style, and that causes difficulty along the entire chain from your hip and your back. So we really focused early on with that process. And Renee will tell you that tends to be a little bit more difficult.
Yes.
Right?
Yes.
Renee, give us a little history about, when, how long you were dealing with knee pain and why you decided to have knee replacement surgery.
Okay. About 30 years ago, David, I was jogging.
Oh.
And I actually fell. And it wasn't even a bad fall, but all of a sudden I had pain in my knee. And it took actually going into the knee arthroscopically about a year later to see that I had actually two tears, two lateral tears. And this one was on the left side of the knee was really very bad. And I guess at the time, the knee surgeon took really all of my cartilage out, left me very little cartilage. So after 30 years of bone hitting bone, you end up with an arthritic condition. And actually my kneecap over the past few years shifted to the left, so that when I walked, this left leg was walking out in this direction.
We call it a turned out knee gait.
Totally. The kneecap was faced in that direction. And I had constant pain also in my hip.
Okay.
So it was just time to go ahead and bite the bullet, and that's why I decided to have the doctor said I needed a total knee replacement. Now
Renee is relatively young in terms of knee replacement surgery. Most patients tend to be a little bit older, where as we talked with Dr. Cunningham, their functioning gets really difficult. So she was having trouble, so she decided to have the surgery. Now, like I said, she's 10 weeks post-op, so it looks really nice now. She's doing much better. She's ambulating better. Some of the things that remain is she still has some atrophy of the muscle, which means the quadricep muscle kind of shrinks down a little bit, and we're working on that through the rehabilitation process. But what I wanted to demonstrate is what we do to gain this extension or the ability to get the knee straight. And like I said, we're going to do this with another patient following Renee, but one of the important procedures after knee replacement surgery is never having anything underneath of the knee, because that will encourage this knee flex position. So when you stretch, you want to have something under your heel, and what I do is I kind of help it by pushing on it a little bit, and we regain that maximum extension to the knee. And this tends to be a little uncomfortable, and it was really uncomfortable early on for Renee, but right now it's much easier, and we can get a little bit more mobility in that position. Some of the other things that are important are we need to have the kneecap with really good mobility, because sometimes the kneecap gets tight and gets bound down. So we always working on keeping that kneecap moving, because without that mobility, the motion of the knee itself tends to be limited. So we focus on that early on as well. So early on in her rehabilitation process, we're doing a lot of things with swelling. We're using ice, we're using soft tissue massage, we're using electrical stimulation. We use any particular techniques we need to reduce inflammation. And then we start working on motion and strengthening and improving her gait and her balance. And we'll show you some of those techniques when we get her up and about. So right now we're working on extension. And then we're going to work on some flexion techniques to get it to bend. And I'm going to demonstrate that as well. So we're going to put you flat. Go ahead down. So, like I said, Renee has pretty good motion now. When she first started, her knee only bent about that far, and there was a lot of pain and swelling. So we needed to slowly get the motion back. And what I like to tell people, and I told Renee the first day, is the magic word is always stop. So I'll push, but she has full control. We never want there to be excruciating pain in this process. There's going to be some discomfort, but never excruciating pain that you should have to tolerate during your rehabilitation process. So we're working on just flexing the knee and getting maximum motion. Now, like I said, she's 10 weeks since surgery. This is really good motion, and she's worked really hard to get that. And the goal is usually about 120 degrees is about all you're going to get. You need about 105 degrees, so that's at about right there to be able to do stairs comfortably, be able to go around on a bicycle. But when you can get that 120, what she's pretty much at right now, then you can do more advanced things. You can get from low chairs or low sofas without difficulty. And Renee has an active lifestyle. She likes to bike and does a lot of walking. So we want to get as much motion as possible with this. Okay, we're going to demonstrate some of the strengthening exercises that we use for post-knee replacement surgery. And the first one is really very simple. We just want to get this muscle contracting, so what Renee's going to do is just push down into the table, and you can see that quadricep muscle contracts, and then she relaxes. And this is an isometric contraction just to get the muscle to start firing. And on Renee, it fires really well because she's been working for the past several weeks on getting that back. But early on in the procedure, most patients have difficulty with that. So it's really important to get that muscle firing early. As it fires, it actually moves the kneecap a little bit, and that gets control of the knee back, and that helps get this knee straight, which is really important, which I'm going to show you on another patient after this. So once she does those quad sets, we also work on active heel sliding, and that's bending the knee back on their own, and then all the way out straight. And since she's more advanced, we can do it with a little bit of weight on, but normally we're not using a weight early on. So this is an active way to get that flexion and extension of the knee. That's a heel slide exercise. Trying to get that normal mobility in the heel joint. Now obviously you're not going to do anything that increases pain, but this is pretty basic, and most patients right after surgery will be able to do this. They just won't be able to go as far. They may be able to go to there, and then they'll have to stop, and sometimes I'll push on it a little bit and give it a little extra stretch. So right now we're still working on motion with this exercise. The third exercise is a straight leg raise, and again, this is a little heavy, but she's pretty advanced. And what she does here is lifts the leg up straight and then backs back down. And as you can see, it takes a lot of contraction of this quadricep muscle and your hip muscles to be able to do that. But you need to have this strength, especially when you're walking and you're doing stairs. So this quadricep is really firing, and we progress the weight, usually no more than about 5 pounds. Then it just becomes a little too much torque to the knee. So that's a straight leg raise. And then we can work on getting the terminal extension actively, and we use a little bolster to do that. So the knee's over the bolster, and then we work on that terminal knee extension, that strengthening of those last few degrees, which is really important for being able to handle the stairs and having normal gait. So in the beginning, we're working on getting that extension passively, or we can stretch it. And then as we get more advanced, we're working on active extension, where we can get as much contraction of that muscle as possible. And that's a terminal knee extension. And we're usually doing sets of 10 repetition, and then sometimes we'll get a little bit more advanced, go to 15 and 20 repetitions. But we'll keep it at this level initially at 10 repetitions and progress the weight. And then another exercise, we sit up on the edge and we do full knee extension. And here she's taking the knee through that full range, go all the way up and all the way down, and getting that full motion to the joint and getting that terminal knee extension, which is really important. And that's full range knee extension. Now, patients are not encouraged to do this kind of stuff at a gym with heavy machinery. It's just too much compression to the knee. We like to use light cuff weights or resisted tubing for home, and every patient gets a home program that they need to work on every day to maintain this and improve some of the strength and mobility. And then the last thing we do, we're going to lay on our stomach and we work on the back of the knee.
It's the one I don't like.
Renee doesn't like this one because this works the back of the knee and the hamstring muscles. So we work on bending, go ahead, all the way up and then back down. And we're working on getting the hamstring muscles, which are in the back of the knee, to regain the strength in those areas. And again, with those patients that have difficulty with flexion, I'll give a little extra push to get more motion if we can in that position. Great. Now what I'm going to do is I'm going to bring another patient in and we're going to show somebody that's a little bit more recent in terms of their surgery and some other techniques we use early on, and we'll come back to Renee to show some more of the advanced rehabilitation exercises. Okay, we're back now and we're with Henry Wollman. Henry is 6 weeks post knee replacement surgery, and as you can see by his knee, a little bit more acute, so there is more swelling to the knee. The knee tends to be a little hotter temperature-wise compared to we saw Renee's knee. And as you can see, he doesn't have that full extension yet. And when he started rehab, he came in and his knee looked like that. All right, so he started having what we call a knee flexion contracture, and we needed to work really quickly on gaining that knee extension. So when he came in, his knee was in that position. He didn't like that full extension. And sometimes during the home care or inpatient rehab process, since there's so much pain, the therapist may not force that. So that's sometimes why that happens. But when we get him, we need to get that really quickly because his ambulation is much different than Renee's in terms of the ability to straighten that knee. So when we're looking at Henry now, we need to get that full extension, and this is the part where we really need to work on that. So we push, get something under the heel, and we push on top and the bottom of the knee, and again that tends to get a little bit uncomfortable, and Henry's in control of that, and he can say stop anytime he needs to. And we also need to get that kneecap moving, and as you can see by his, there's really not a lot of motion in there compared to Renee's. So we need to really focus on getting that kneecap with more mobility, and that will help the motion of the knee. Now, some of the other things that happen when you lose this extension, your hamstring muscle gets tight. So we need to stretch that hamstring. And Henry works on this at home, and that's not the most pleasant position. But the hamstrings are the muscles in the back of the thigh here and go underneath the knee. And they get a little shortened because you don't have that full extension. So we need to work on that as well. So terminal extension is really important. The other thing is he still has some swelling, and we'll demonstrate some other equipment that I use to reduce the swelling. But in his case, we want to do a lot of soft tissue milking of the swelling. So we're using a little bit of cream, and we're just pushing all the edema out of the knee, up into the thigh, and then the body can get rid of it a little bit more easier than it can when it's stuck in the joint. So we do everything pushing it up, everything pushing it up. And that encourages mobility of the soft tissues and the swelling in the area. So when you have somebody work on your knee, you just don't want to push it down because the swelling tends to then gather in the foot. We want to get it up here where your body can get rid of it. So some soft tissue work, the same with the back of the knee. And that way, we relax these muscles So then when we go to push on it, it's going to go a little bit easier, like it does now. And we'll use some moist heat at his stage. Early on in the process, we're not using any heat because there's too much swelling and the joint's too hot. But right now, at 6 weeks, we use some heat, we relax the tissue, and it allows us to stretch a little bit more. So after we get that extension, we start working on the flexion with Henry. And as you can see, compared to Renee, he has about 85 to 90 degrees right there. Not as much motion, so we need to get a little bit more aggressive with that. And I'm just going to turn my back a second so you can see the little bit more aggressive technique for the gaining flexion. And I'm pushing on it with the support of my shoulder, and then I bring it out and relax. And we want to hold that to his comfort. Again, he's in control. He can always say stop if it's too much. And I'm pushing a little bit further. Now you can see it goes past that 90 degrees. And he's probably close to 95, 100 degrees right there. And sometimes I like to do a little soft tissue work to the thigh and getting that to relax as I push on it. Great. And then some of the other exercises are similar to what Renee was doing. So we'll show you some more of the advanced stuff as we move over to the equipment. Okay, we're back here with Renee Gast, and we're going to show you some more advanced techniques for regaining motion of the knee, increasing strength, and improving her ability to function. One of the most easiest ways to get strength of the entire complex of the knees is through squatting. Now, standing squatting is a little too much compression to the knee, so we use this device. This is a gravity training system where we can reduce the amount of stress to the knee joint and improve the motion at the same time. So we're going to have Renee lay back, and we'll demonstrate how she regains some of that motion and strength for squatting. Go ahead up from there, Renee.
Scoot up.
There you go. Good. Okay, so she can get, remember, this is the knee replace side. Get head down. And just keep going through the repetitions, okay? And you can see she gets pretty full motion there, and we're working on terminal extension. And we can change the angle depending on their level. She's pretty much at a high level right now, and she's able to gain really a lot of motion with this. And we're working on gaining the stability in what we call a functional position, or more of a closed chain position, where the foot's in contact with the ground. So as you saw when I had her on the table, I was regaining her motion just pushing on it. Here her foot's in the ground, and we're getting a little bit more mobility that way. And we're building strength of the quadriceps, the buttock muscles, the gluteal muscles. She's working on her pelvic muscles as well. And we do 30 plus repetitions of this to regain function. And this helps improve with stair climbing as well. Okay, we're going to switch the machine, and we're going to show you how we work the back of the thigh. So come sit up from there and stand up. There you go. Okay, come on up here. So now we're working the hamstring muscles.
I have to pull myself
Yep.
up.
And again, Renee is a little bit more advanced, and some other patients we're not going to do in this position, especially the more geriatric population. As you get older, it's not very comfortable laying upside down slightly. Go ahead. And we're working on, again, more advanced training of the hamstring muscles, which are the muscles in the back of the thigh that helps with stability of the knee. Okay, and we can change the resistance by changing the angle of elevation here. And in Renee's case, she's kind of at a medium angle, and we started really low when we first started. And to make it even more difficult for her, we have her sit up, and that's a little different angle for the hamstring muscles, and she can work in that position as well. Good. And rest. Okay, we're back showing you some more advanced techniques for post-op knee replacement surgery. And one of the more basic things we need to work on is stairs and stair function. So Renee's just going to demonstrate how she goes up and down the stairs where we work on control. Go ahead as I talk. Show me.
All the way up.
Yep, all the way up. She's stepping up and then back down okay? And then she's at a pretty high level. So what we're doing is we're working on control and stability of this left knee. Yep.
Okay.
I want you to go up and come down with the right knee like that, just like that, okay?
This again.
Go up with the left and down with the right, and that improves control of that muscle. Now, as you can see, that's still a little difficult for her going down. We call that eccentric control of the muscle, and she just doesn't have full control yet. So watch. We make it easier for her. Go ahead. Go up and watch coming back down. It's much easier. She has more control of the knee coming back down. She's not jumping down. So that's where we need to continue to work on, Renee, by building some of the stability of that muscle. So I'm going to show you some more advanced things now in terms of balance and control. This is really important for dynamic balance. This is called the RX. Come stand up on there, Renee. And just one foot. We're going to use your bad foot.
Oh, the bad foot.
Bad foot, okay?
The bad one.
And one of the things that we need to work on what we call a compliant surface, or the ability to balance on uneven surfaces. If you're working on walking on gravel or sand on the beach, you need to relearn that ability after you have a joint replacement. So this is one of the techniques to do that with. And that's a compliant surface, or an RX. And she's just trying to build a balance and control. And we'll make it more difficult by having her close her eyes. And then it's really hard for her.
Oh my God.
And now she's getting all the feedback from the joints, so that gets it more difficult.
That's amazing.
All right, step off a second. And then now we get really advanced. And let's do the side to side first and then corners. And this is a core board, and we work on more dynamic balance. Again, just in daily life, you need to be able to handle these kinds of stresses. And this is dynamic balance control on a core board. And I can vary the resistance. I can make it harder in different angles, and show us the diagonals, Renee, where you go in different positions.
Just hold on to
Yep,
it while I do.
I got you. And we're going back into different diagonals. So in everyday life, everything's not in a straight plane.
I don't think I have this.
So we need to work on diagonals. So she works on going forward and back in a more dynamic fashion. Okay, so that's some of the advanced things in knee replacement surgery. When we come back, we're going to introduce a hip replacement patient and talk about some of those procedures that are done following the surgery. Thanks, Renee. Great, come on over. Okay, we're back, and we're going to talk now about the rehabilitation procedures following total hip replacement surgery. We're here with Ray Sleesh. Ray had hip replacement surgery about 4 months ago, so he's very advanced in terms of the process. He's no longer undergoing rehabilitation at this point, because most patients are usually done by the 3-month period. But I brought him back to demonstrate some of the techniques that we do immediately after surgery, and then as we get more advanced in the rehabilitation process. Ray, why don't you lay down on your back? Now, Ray had pretty severe degenerative joint disease in his left hip, and that was the reason why he underwent joint replacement surgery. And right after the surgery, there's some very important precautions that are necessary following joint replacement surgery. Number one, those patients, we never want to have them bend their knee up toward their chest higher than the level of their hip, or 90 degrees from their body. That's a post-op precaution, and we don't want to cause any dislocation of the hip. So it's really important to understand that. The patients are also not allowed to cross their legs. Okay, that's a contraindication. Or they're not allowed to turn the hip in and pivot. So when they're standing, kind of turn and pivot the opposite way. So those 3 things are important precautions for the patient to understand when we start the rehabilitation process. And then what we're working on, just like the knee replacement patient, is decreasing pain, reducing some of the swelling, and regaining some of the mobility of the joint. And we'll do that with various techniques. Now, if you go on your right side, right? One of the biggest problems with hip replacement surgery is the incision goes on the outside part of the hip, okay? It's a pretty big incision. It goes on the outside part of the hip. And what happens is, depending on where the surgeon does the procedure, some of them do it a little bit lower, some of them do it a little bit higher. But one of the things that occurs is the muscle that controls the ability to lift your leg out to the side like that usually gets affected during the surgery, and that's very weak. And that's why you'll see patients after hip replacement surgery have a little bit of a waddle when they walk. And that waddling is because this muscle has gotten very weak. So early on in the rehabilitation process, we need to teach this muscle how to function again, because sometimes it is displaced from the hip during the procedure, and then the surgeon reattaches it. So we need to retrain that process. Sometimes we use electrical stimulators to get that muscle firing again. And we'll also use some manual techniques. And some of the manual techniques would be just getting the person to hold their leg like that against gravity. And then as it gets easier for them to do that, then we can add some resistance and we do some repetitions. So go down, Ray, and then come back up from there. So all we're doing is we're working on control of that hip abductor muscle, which is typically cut during the procedure. So as this gets stronger, their waddle gets better when they're walking. So we'll work on that really strongly. We'll also want to work on getting the extensor muscles or the gluteus maximus muscle to have good function. So one of the other exercises we work on is a resisted leg press where we push all the way back and we're taking the hip through full motion to get the extensor muscles to really fire. Now what does this look like? This is a simulation of walking. This is what the person does walking. So all we're doing is we're reproducing that motion. Every time they take a step, there's resistance from the floor, and I'm doing it with my hand. So this is a way to simulate that activity. Okay, we also want to work some of the muscles inside the hip, so lay on your back, right? And here, we re-educate the adductor muscles of the inside of the thigh. Bend your knees. So I have them squeeze a towel roll, and that gets the muscles that run deep inside the thigh to start firing. And if we want to make it even more dynamic, we do a little bridge with it, right? So that works the muscles inside the thigh and the buttock muscles. Now again, Ray is pretty advanced. He's 4 months in surgery. Early on in the process, the person may not be able to do this, so we start a little bit more basic. What I may do is, I may just do that manually, where I'll hold the leg like this, and I'll just have the person resist me to get those muscles firing. Okay, so the hip, like the knee, we're retraining muscles, we're trying to regain motion. We have some precautions we need to be aware of. We can't push the knee all the way to the chest, we can't cross the legs, and we can't turn it in. So those things are really important to understand during the rehabilitation process. And as the patient gets more and more strength in the leg, we can start doing more gait activities, or the ability to ambulate, and more dynamic balance activities. But right now, early on, we're trying to retrain some of these muscles. So we're going to take Ray over and show you some more advanced gait training activities, and we'll follow up there. Okay, we're back with Ray. And again, Ray has a left hip replacement, and we're working on retraining some of these muscles when he's walking. So this is an exercise in which we have resistance from the cable machine. Go ahead, Ray, step out. And we can retrain some of these abductor muscles, or the one I talked about that gets cut during the surgery. Okay, go back in now. And as he's doing this with the resistance of the weight, he's retraining these muscles to handle this ambulation sideways. Keep going, right? Keep going. Okay, so we're working on the outside part of the hip, and we would do this in both directions because it'll retrain those muscles in multiple directions. So I'd have him turn and face me, but let's just keep going this way. So as you can see, he still has a little bit of hitch as he's walking. Still has some residual weakness that he's working on his own, following the rehabilitation program. Now let's turn backward, and we do some backward walking as well. And again, this is important for retraining the gluteal muscles and stability and balance. Go ahead, Ray, go ahead back. Now again, this is an advanced exercise for hip replacement surgery. We're not doing this early on, but as they get more advanced, we need to do some more dynamic activities to build up the strength and control for his walking. We would do similar things as we did with Renee in terms of dynamic balance, using the, keep going, using that functional board, using the mat, and all kinds of dynamic exercises for dynamic balance. So this is resisted walking. Great. And we'll go back in, and we'll do a bunch of repetitions with that. Just stay right there. Okay, so today you learned about the post-operative program following knee and hip replacement surgery here at DB Orthopedic Physical Therapy. We showed you what it was like following the surgery, some of the swelling that occurs, some of the limited motion. Then we work on developing strength and mobility, and then eventually, like we did with Ray, showing you more functional activities to help you regain your prior level of function. And in some cases, dramatically improve your function, because before the surgery, most patients really have difficulty ambulating, doing stairs, and enjoying their life. So joint replacement surgery is something that you can really recover from and have a much better outlook in your life and be able to enjoy your life once you go through the surgery and the rehabilitation process. So for now, I'm David Bertone, and thanks for joining us for You and Your Health.